So, hello friends, good evening. Welcome to this YouTube live session for rapid revision on physiology. And the topic that I have selected is cardiac cycle. Now, uh, why did I select this particular topic for rapid revision? There are two important reasons. Two reasons hai. One is that no exam is complete without the question on cardiac cycle, whether it's a first prof exam or NEET PG exam also. You will see every exam there is one question on cardiac cycle. So that is one reason. And the other reason is that this is a high yield topic, means there is a possibility of multiple MCQs from this particular topic. So have this topic pit pat, and then uh, you are confident enough to answer lots of questions. So let's see, have a quick revision of this topic. Now, first thing, when I say cardiac cycle, it means these four things. And there have been MCQs in the recent past on all these. So we will start with those MCQs. I will ask MCQ on each one of them, and then we will start the discussion. All right. So let's have a look at the MCQs first. Okay, events, the cardiac cycle. Let's have an MCQ on this. Simple MCQ. Which of the following is called as or atrial heart sound is a it's on the heart sounds. Let me ask another MCQ. Okay, second heart sound occurs in which phase of the cardiac cycle? Okay, second heart sound occurs in which of the following phase? Okay, and the options are protodiastole, isovolumic relaxation, first rapid filling, or diastasis. This MCQ has come in the recent past in one of the exams. Want to answer, you can answer, but second heart sound occurs in which phase of the cardiac cycle? The answer is protodiastole. We will discuss it. I'm just giving you the answers that to have that. So protodiastole, first phase of the diastole, and at the end of it, I mean, there is second heart sound. So protodiastole ends with the second heart sound, and then there is isovolumic relaxation. So this was the answer. That was question number one. Then the question on heart sounds. Heart sounds is related to the cardiac cycle, and MCQs are asked clinically. But I am asking a simple question. Which of the following is called as atrial sound? Among the heart sounds, which of these is called as atrial sound? And the options are, of course, S1, S2, S3, and S4. Simple question. So, what's the answer? Atrial sound. Well, fourth heart sound is called as the atrial sound because occurs due to the atrial systole and a turbulence of blood from atria to the ventricle. So that produces the sound, and therefore All right. So some technical glitch there been sorted. So let's continue now, and let's have another MCQ. So there was a question on events in the cardiac cycle. Then there is a question on heart sounds, and of course JVP and left ventricular pressure volume loops. So have a question on JVP. Very commonly asked this topic. So C wave in the left atrium is larger than the C wave of the JVP. Because of what? That was an MCQ which was asked long back in the INICET. C wave in the left atrium is larger than the C wave of the JVP, which is the reflection of right atrium. Right atrium and left atrium should record same pressure changes. They do so, but what happens is C wave of the left atrium is larger than the C wave of the right atrium or JVP. What is the reason? And the options are, I'm not spending any time on writing the options. The options were like this: because left atrium is a thicker muscle mass. B, because left atrium receives the blood from the pulmonary circuit, from the lungs. C, because left ventricle is a high pressure chamber. Or D, because left ventricle pumps into the aorta, which is a high pressure vessel. These were the four options, and the answer was because left atrium receives the blood from the lungs. And why therefore it creates a larger C wave? We will talk about it in our discussion. So that was one more question. And then finally the question on left ventricular pressure volume loop. So they give you the left ventricular pressure volume loop, and then the question that is asked is this: there are 4 points A, B, C, D which are shown in this diagram. Which of them correspond with the arterial diastolic blood pressure? So I'll just write it here: arterial diastolic blood pressure. Which point exactly corresponds with the arterial diastolic blood pressure? And the options are A or B or C or D. Again, a question related to the cardiac cycle and left ventricular events. And the answer, of course, is B, because it is the end of the ventricular diastole. The ventricular diastole ends there. That time the pressure in the arteries will be called as arterial diastolic blood pressure. So this is how they ask the questions on various components of the cardiac cycle. Now with that in mind, therefore let's start our discussion on a quick rapid review of the cardiac cycle, starting with the events. So let's start with the basics first. Cardiac cycle means what? One beat, the changes that occur in one heartbeat and repeated cyclically in the subsequent beat. Duration of the cardiac cycle. What is the duration? Look, if the heart rate is 72 beats per minute, which is the normal heart rate, that means 72 beats occur in 60 seconds. Then what is the duration of one heartbeat? It is 60 upon 72, and that is 0.8 seconds. All right. So MCQ can be, they can give you the heart rate and ask you to calculate the cardiac cycle length. Very simple MCQs are sometimes asked. Anyways, but the point that I want to make here clinically, because you all are NEET PG preparing students, that means you have read this topic previously a number of times and you have a fair idea about it. So our discussion will attain a certain height once we start the discussion. Okay, for example, here I want to make a mention, यहाँ पे मैं बात add करना कि at higher heart rates, like 100, 120, 130 beats per minute, 150 beats per minute, cardiac cycle duration will be shortened. And that means systole and diastole, ventricular systole and diastole, both will be shortened, right? But diastole suffers more. This is the clinical point that you must keep in mind. When heart rate increases, cardiac cycle length will be shorter and shorter. Each beat will have shorter duration. And therefore, that means ventricular systole and ventricular diastole both will decrease in duration. But diastole, ventricular diastole will suffer much more. Means its duration will be shortened to a much greater extent. So that's an important point which has clinical implications. That later. Okay, so that's the introduction. What about the events? Let's have a quick recap of the events. You know, heart is made up of two syncytia. Both atria make up one syncytium and they work together. And both ventricles make another syncytium. They both work together. Okay, so events are going on in the atria. At the same time, the events are also going on in the ventricles. So let's see atrial events. For this entire 0.8 seconds, something is going on in the atria. Systole is for 0.1 second and atrial diastole for the remaining 0.7 seconds. Ventricular events. At this time, when atrial events are going on, thing is happening in the ventricles also for the same 0.8 seconds duration. Ventricular systole, the diastole. Let's see the duration also. Systole is for 0.3 seconds and ventricular diastole is for the remaining 0.5 seconds. So these are the events in the cardiac cycle. Okay, for the same 0.8 seconds duration, something is going on in the atria. At the same time, something is going on in the ventricle. Okay, and as I mentioned, as the heart rate increases, cardiac cycle duration becomes short and short and short. So ventricular systole and diastole both will decrease in duration. But diastole, ventricular diastole is the worst sufferer. It suffer more. Its duration will be to a much greater extent. So that is about the events. All right. Now next, let's discuss the events in detail. Okay. So you know this particular diagram, and you might have seen the videos also on this. But I am going to add a new feature for this discussion. Okay, something new will be added in this particular diagram. We are representing a cardiac cycle and we will show the events in these two circles. Inner circle represents atrial events, outer circle will represent the ventricular events. Means we will write the events there. Okay. What I am going to add, which is not there in the recorded videos, but for the first time I am adding those things in this diagram, is correlation with the ECG. Because you know, nowadays lots of MCQs come when they give multiple events together. Like you have to arrange the events in the correct sequence. P wave on the ECG, then ventricular systole, then JVP has a C wave, something like that. They give it jumbled and they ask you to arrange it in the sequence in which those events occur. Okay, so we will add those things in this particular diagram. Now first of all, this entire circle represents 0.8 seconds. Okay, one heartbeat or one cardiac cycle. I divide it into 8 equal parts. So each part is 0.1 second. Okay, and the entire cycle is 0.8 seconds, one heartbeat. So when I start writing from this point and I go on describing, and when I come back to that same point, one cardiac cycle will be over, one heartbeat will have been described completely. All right. And as I said, atrial events will be the inner circle and ventricular events on the outer circle. What is the advantage of this diagram? It tells you when something is happening in the atria, what is happening in the ventricles at that exact same time. That is that can be seen clearly from this diagram. That is why just have a clear-cut idea about these events. Let's start. Atrial systole. I'm sure you must have done this a number of times since first year. So we will go fast here, and then JVP and left ventricular pressure volume loops, we will spend some more time. Okay, so atrial events, we will write it in the inner circular strip, right? Atrial systole, 0.1 second. So one part. Okay, atria contract and pump the blood into the ventricle. But what I want to tell you is atrial systole, let's write it here. Atrial systole is sometimes described as myotonic contraction. Look, you know two types of muscle contraction, isometric and isotonic contractions. Okay, but there are two more contractions that you can learn in the cardiac cycle. One is myotonic, which I'm discussing here, and then next will be the ventricle. So atrial systole is sometimes called as myotonic contraction. Why? Because atrial systole is divided into two halves. The first half, that is first 0.05 seconds, is more dynamic, stronger contraction of the atria, and later 0.05 seconds, later half is called as adynamic. So initially the contraction is strong, and then later part the strength of contraction is decreased. Such contractions are called as myotonic contraction. You must have heard the word meiosis. Meiosis means reduction, division. So myo means reducing strength of contraction. So remember, atrial systole, initially stronger contraction, and then it becomes weaker. Okay, dynamic atrial systole, adynamic atrial systole, half. All right, so that was atrial systole. Now the atrial diastole, 0.7 seconds. So atrial diastole, 0.7 seconds, that means 7 parts. Atrial diastole, 7 parts. Atria relax and receive the blood. Right atrium receives the blood from the venae cavae, left atrium receives the blood from the lungs. All right, so this is what is these are the events in the atria. Now let us start with the ventricular event. And before I start that, let me just add it here that before the start of atrial systole, over here, I would like to show the P wave. That is an additional feature of this particular lecture. Correlation with the ECG events. So there will be a P wave just before atrial systole. Okay, atria will depolarize. That is what is a P wave, atrial depolarization, followed by the atrial contraction. Okay, so P wave, then the atrial systole, then the atrial diastole. Right, now ventricular events on the outer strip. So let's start with the ventricular systole, 0.3 seconds. So 3 parts. 0.3 seconds ventricular systole. So 3 parts. Okay, 1, 2, 3. Right. Note one point. Ventricular systole has started at the end of the atrial systole. Why is that? It is because of the AV nodal delay. Because of the AV nodal delay, atria excite first and they contract also first, and the impulse reaches late into the ventricles. So ventricular contraction occurring after the atrial systole is over. Okay, right. So therefore, that's one point to be noted. Two systoles never overlap. Two systoles means atrial systole and ventricular systole never overlap because of the AV nodal delay. And remember also, two diastoles always overlap, atrial diastole and ventricular diastole. Okay, Now coming to the ventricular systole. Now first thing on the ECG, there will be a QRS complex. So let's write it here. There is a QRS complex which is ventricular depolarization. Okay. And after that, the ventricular contraction systole will start. So I'm writing the QRS complex over here and then followed by the ventricular systole. Okay. Now first thing, as the systole starts, ventricular pressure rises and it becomes more than the atrial pressure immediately. So what happens? AV valves close. AV valves close. And this closure of the AV valves produces the first heart sound. So we know two things about the first heart sound. That it occurs at the onset of ventricular systole and it occurs due to the closure of the AV valves. Okay. Now, AV valves have got closed, but semilunar valves have not yet opened. Okay. Pulmonary and aortic valves have not yet opened. So, all four valves are closed right now. Ventricles are contracting like a closed chamber. This is called as isovolumic contraction. Isovolumic. Now I want to add some clinical punch over here. So those who are listening can have this can listen to this part. Clinical punch. Now look at this phase, isovolumic contraction. And let's talk about the left ventricular phase. Now, just we said that AV valves close. So let's talk about the left ventricle. Mitral valve closes, but aortic valve is yet to open. Aortic valve has not yet opened. Let's show it here. Left ventricle, and this is the aortic valve. Aortic valve has not yet opened. Why aortic valve has not yet opened? Because left ventricular pressure, which is rising actually, but it has not become greater than the aorta pressure. When the left ventricular pressure becomes more than the aorta pressure, only then the aortic valve will open and the ejection will start. But that has not happened yet. Okay. Which means what? Which means during this phase, aorta pressure is still more than the left ventricular pressure. Now imagine, aorta pressure is still more than the left ventricular pressure. Now consider a disease, consider a valvular heart disease called as aortic regurgitation. Aortic regurgitation. If the aortic valve is incompetent and aorta pressure is more than the left ventricular pressure, what will happen? The blood will go from aorta back into the left ventricle in this phase. Do you understand this? आप इस बात को समझ पा रहे हो कि लेफ्ट वेंट्रिकल का प्रेशर बढ़ रहा है, सिस्टोल स्टार्ट हो गया और एवी वाल्व मतलब माइट्रल वाल्व बंद हो गई, लेकिन अभी एओर्टिक वाल्व ओपन नहीं हो सकी है. क्यों? क्योंकि लेफ्ट वेंट्रिकल का प्रेशर अभी एओर्टा के प्रेशर से ज्यादा नहीं हुआ है. आई एम जस्ट रिपीटिंग द थिंग्स. तो इसका मतलब अभी एओर्टा का प्रेशर लेफ्ट वेंट्रिकल के प्रेशर से ज्यादा है. और सोचो ऐसे में द कंडीशन कॉल्ड एज एओर्टिक रिगर्जिटेशन. तो क्या होगा? एओर्टा का प्रेशर ज्यादा लेफ्ट वेंट्रिकल के प्रेशर से और एओर्टिक वाल्व इनकॉम्पिटेंट, तो द ब्लड will go from aorta back into the left ventricle during this phase, isovolumic contraction. So I want you to understand this. In the condition of aortic regurgitation, even though left ventricle will be contracting in this phase, isovolumic contraction, okay, left ventricle is contracting and yet it will receive the blood from the aorta. Blood will come into the left ventricle even though left ventricle is contracting. See, I hope you understand the significance of this point. When you say there is systole, there is contraction of the chamber, it means the blood is ejected out, sent forward by that chamber. But in this condition, this is a unique situation, aortic regurgitation, that the left ventricle will be contracting. There is isovolumic contraction because aortic valve is regurgitant and aorta pressure is left ventricular pressure. The blood will regurgitate back into left ventricle, even if left ventricle is actually contracting. Anyways, much about that later when we discuss the diseases. Okay, so isovolumic contraction. Now left ventricle, the ventricular pressure is rising, and soon it opens semilunar valve. It becomes great enough to open the semilunar valves. Semilunar valves open, and therefore then there will be ejection of blood, right? Ejection of blood in two phases. So let's show it here. First will be rapid ejection. Okay, rapid ejection. Why? Because this is the starting of ejection. This time the aorta is relatively empty. Aorta and pulmonary artery, they are relatively empty. So blood will be ejected out rapidly. But then as the blood is filled into those vessels, means aorta and pulmonary artery, then the later part of ejection will be slowed down. So it is called as reduced ejection. Reduced ejection. So these are the phases of ventricular systole. First, there will be electrical event, that is QRS complex. Right? Where is it gone? Okay. QRS complex on the ECG, which is the ventricular depolarization. And after that, the mechanical event of ventricular systole will start. Okay, and these will be the events. First heart sound, then the isovolumic contraction, then the rapid ejection and reduced ejection. Now just to add one more additional point here, that is ventricular systolic ejection has been described as auxotonic contraction. Auxotonic contraction. What is auxotonic contraction? Left ventricular systole and the contraction of left ventricle is called as auxotonic contraction. What is auxotonic contraction? As the contraction proceeds, strength of contraction goes on increasing. Okay, and I'm talking about single contraction. Okay, as it happens, the strength of contraction goes on increasing. Such a contraction is called as auxotonic contraction. Left ventricular systole is described as auxotonic contraction. Why it is described as auxotonic contraction? It's because, look, as the systole happens and then ejection, blood starts filling into the aorta and pulmonary artery. So for the further and further ejection, there will be resistance. There will be resistance to the outflow, and the ventricle has to overcome this resistance and further eject the blood. So left ventricular strength of contraction goes on increasing. Okay, and therefore left ventricular systolic ejection, that contraction has been described as auxotonic contraction. As the strength, as the contraction proceeds, strength of contraction goes on increasing. So this is about ventricular systole. Now next, ventricular diastole, 0.5 seconds for 5 parts. Ventricular diastole, ventricular diastole, ventricular diastole, ventricular diastole, and ventricular diastole. 5 parts, 1, 2, 5. Now, first thing, note here is that for most part of the ventricular diastole, atria are also in diastole. Take it out here in the diagram. Ventricular diastole, atria are also in diastole. And only the last part of the ventricular diastole coincides with atrial systole. Check it out. Which means what? Which means 75 to 80% of the ventricular filling is passive. Yes, let's write it here. 75 to 80% of the ventricular filling is passive. Means ventricles are in diastole, atria are also in diastole, so blood just comes in, fills the atria and then goes into the ventricles passively. Only the last 20-25% filling is because of the atrial system. So last 20 to 25% filling of ventricles is active. That is because of the atrial systole. As we can see in this diagram, again, just to confirm, ventricular diastole, 5 parts, and out of that the 4 parts, the atria are also in diastole. The last part of the ventricular diastole coincides with atrial systole. That time the atria will contract and actively send the blood into the ventricle. All right, now let's talk about the events, the ventricular diastole. Okay, first event is protodiastole. Please remember, protos means one, proton, protos means one, number one. So number one event of the diastole is protodiastole. Here, protodiastole. All right, what happens in this phase? See, so far the ventricles were in systole. Now suddenly the ventricular pressure begins to fall. Ventricular diastole has started, ventricular pressure begins to fall. So the blood that was ejected forward, the blood that was sent forward by the ventricles, it starts coming back toward the ventricle. This sudden change in the direction of the blood is called as protodiastole. So what happens in the protodiastole? Sudden change in the direction of the blood. But then valves, semilunar valves, they are meant to prevent this backflow of blood into the ventricle. So next thing that happens is semilunar valves close. Semilunar valves close, and this closure of the semilunar valves will the sound which is called as second heart sound. Let's write it here, S2. And therefore we know two things about the second heart sound. One is second heart sound occurs at the beginning of ventricular diastole, and it occurs due to the closure of the semilunar valves, aortic and pulmonary valves. Now a clinical punch over here. Imagine that a condition, okay, we'll talk about it in just about 1 minute. Now semilunar valves have got closed, but AV valves are also closed. See, AV valves have got closed already and they are closed. Now semilunar valves have got closed, ventricles are in diastole, but filling cannot start. Ventricular diastole has started, but ventricular filling cannot start. Why? Because AV valves are also closed. They have not yet opened. Why they have not yet opened? Because ventricular pressure, although it is falling, has not gone below the atrial pressure. You see this here? Ventricular pressure became more than the atrial pressure, the start of systole. Now it has begun to fall. अब ये pressure fall हो रहा है ventricles का, diastole में चली गई, लेकिन अभी भी ventricle का pressure atria के pressure से नीचे नहीं गया है, तो AV valve अभी open नहीं हो है, और इसलिए there is a period called as iso relaxation. So this period is called as isovolumic relaxation. Oh yes, by the way, you notice the fact that second heart sound occurs at the end of the protodiastole, and therefore technically speaking it occurs during the protodiastole, the MCQ that I asked at the start. Okay, so isovolumic relaxation. Okay, Now, a clinical punch that I was talking about. Imagine the condition of mitral regurgitation. Mitral regurgitation. Okay, here we are talking about ventricular diastole. Okay, let's talk about left ventricle. Let's write it here. Left ventricle. There is aortic valve which has got closed now, but the mitral valve has not yet opened. So ventricular filling cannot start yet. Okay, both these valves are closed. I'm talking about left ventricle only right now. Now what happens is ventricular pressure is decreasing. It's a diastole, but it has not become less than the atrial pressure. Okay, left ventricular pressure, although it is falling, it has not become less than the left atrial pressure. So this mitral valve could not open yet. Okay, which means what? It means left ventricular pressure still more than left atrial pressure. That is why the mitral valve could not open yet. Okay, now imagine a condition called as mitral regurgitation. Mitral regurgitation. Mitral valve regurgitant. Now in this phase, isovolumic relaxation, ventricle is relaxing and its pressure, left ventricular pressure, is still more than the left atrial pressure. Therefore, if the mitral valve is regurgitant, then blood will go from left ventricle to left atrium during isovolumic relaxation in the condition of mitral regurgitation. Okay, why? Because blood knows only one thing, that is to flow from high to low pressure. So in isovolumic relaxation, left ventricular pressure is still more than the left atrial pressure, and therefore if mitral valve is regurgitant, then the blood will go from left ventricle to back into the left atrium. Okay, that is mitral regurgitation. And the beauty of it to be understood is the left ventricle is relaxing and yet it is sending the blood out, isn't it? See, what is the purpose of ventricular relaxation? To receive the blood. Okay, but here if the mitral valve is regurgitant, left ventricle is relaxing, but because its pressure is still more than the left atrial pressure, blood will be sent out by the left. Okay, amazing physiology. This way the physiology, pathophysiology, medicine can go on forever. I just wanted you to understand this point, that in mitral regurgitation, in this phase, isovolumic relaxation, blood will go from left ventricle to left atrium. So ventricle is relaxing and yet it is sending the blood out instead of receiving. That's what. Okay, so finally what happens is left ventricular pressure, ventricular pressure was falling. It's a phase of diastole. Diastole is occurring, so ventricular pressure finally becomes less than the atrial pressure. Ventricular pressure becomes less than the atrial pressure. So finally, AV valves will open and the ventricular filling will start. Now, first, there will be a first rapid filling. First rapid filling. Why rapid? Because AV valves were closed for such a long time. They closed at the start of the systole over here, and then ever since that they were closed. So blood came and accumulated in the atria. All right. Therefore, as soon as the AV valves open, there will be a first gush of blood from atria to ventricle. That's called as first rapid filling, and this first rapid filling produces a sound called as S3, third heart sound. Then next, there is a phase called as diastasis. Diastasis. What is the meaning of it? meaning is diastole stasis. Diastole stasis means not much filling. Okay, because ventricle is in diastole, atria are also in diastole, and one gush of blood has already gone, first rapid filling. So there is nothing to fill in this phase. So it's called as diastasis, diastole stasis. Okay, not much filling. And then last part of the diastole corresponds with atrial systole. You can see here, therefore there is one more gush of blood called as last rapid filling. And this last rapid filling, because the blood goes with certain turbulence, it produces another sound called as S4. And therefore S4, which is produced by the atrial systole and turbulence of blood, this sound is called as atrial sound, the MCQ that I asked at the start of the lecture. So these are the events during the cardiac cycle, and let's just try to make it in one screenshot possible. I think it's not happening right now. Okay, zoom. Okay, now it's happening. So here is the cardiac cycle in a nutshell, and you can see the phases. Look, how do you remember the events and the sequence of events? Simple thing is, just remember valves open or close based on the pressure gradients between the chambers. Once you have understood that, then the understanding of cardiac cycle is much easier. So this was the cardiac cycle and the events. We have correlated this with the ECG also, ECG events. Now finally, let's talk about the left ventricular pressure volume change, or left ventricular pressure volume loop. There was a quick MCQ which I asked during the recorded videos. Left ventricular pressure volume loop is shifted to the left. Which of the following conditions? Mitral stenosis, mitral regurgitation, aortic stenosis, aortic regurgitation. Do you know the answer? Shift to the left. Okay, the answer is mitral stenosis. Why is that? You can watch the videos for that. But let's have a look at the loop now. Quick recap. Okay, on vertical axis we have pressure of the left ventricle, mm of Hg. On the horizontal axis we have left ventricular volume, ml, right? So volume 50 ml, 100 ml, 130 ml. Pressure 50 mm of Hg, 100 mm of Hg, 130 mm of Hg. Okay, just follow the arrow and you know which phase is happening. Phase 1, see, arrow is going from 50 to 130 ml. So this is the period of filling. Okay. Phase 2, see what is happening. For the same volume, now the arrow is vertically going up, means pressure is going up. So same volume and pressure is rising, means isovolumic contraction. Then phase 3, see the arrow from 130 ml, the 130 ml point, arrow is coming back to 50. That means blood is ejected out. So this is the phase of ejection. And phase 4, vertical arrow coming down. Phase number 4, see, volume same ka same, 50 ml, but pressure is falling on the vertical axis. So same volume but pressure is falling, that means isovolumic relaxation. So this is the phase of filling, phase number 1, then isovolumic contraction, number 2, then ejection, phase number 3, and isovolumic relaxation, phase number 4. If we have to show valves, how the valves open at various stages, Uh, this is the stage where mitral valve opens. Mitral valve opens. Point A. Because mitral valve opens, the left ventricular filling will happen. Phase of filling will happen. Then at point B, mitral valve closes. Mitral valve closes. Okay, that is point B. And mitral valve closed means ventricular filling is over. Left ventricular filling is over. But aortic valve is yet to open. So mitral valve closed, but aortic valve is yet to open. That means isovolumic. Finally, at the end of it, the aortic valve will open. Okay. At point C, the point C, aortic valve will open. Aortic valve open point C. And since aortic valve opens at point C, ejection will start. The phase of ejection. And at the end of the phase of ejection, here the aortic valve will close. So this is how mitral and aortic valves are opening and closing at various points. Aortic valve closed at point D, the point D. Okay, let's try to have out. Yeah, here it is. This is the left ventricular pressure volume loop in one screenshot. And basically, finally coming to that MCQ which I asked, and then we will stop this rapid revision over here. The MCQ was point B corresponds, the question was which point corresponds with arterial diastolic blood pressure. Answer was point B. Why? Because arterial diastolic blood, look, the question is on arterial blood pressure and they are showing left ventricular curve and they want to correlate the two. Okay, so let's correlate. What is arterial diastolic blood pressure? Lowest pressure in the arteries when the heart goes in diastole. That is called as arterial diastolic blood pressure. Lowest pressure in the arteries when the heart goes in diastole. Okay, so that lowest pressure comes by the end of the diastole. Okay, when the ventricular diastole is ending, that time what is the pressure in the arteries? That pressure is called as arterial diastolic blood pressure. So tell me in the graph which point shows that the ventricular diastole is ending. It's the point B, and therefore this point corresponds with arterial diastolic blood pressure. Okay, so when the left ventricular diastole is ending, that time there is a lowest pressure in the arteries, and that is called as arterial diastolic blood pressure. So there is much to talk about, but since this is a rapid revision, therefore I thought I will cover the major events, correlation with the ECG and left ventricular pressure volume loop, because that is one thing I expect to be asked in the upcoming NEET. So I hope it was a productive session. Next time we will also have another high yield topic. Thank you. Goodbye.